Welcome to the Review Network, where we take a closer look at the services students rely on, breaking down what they offer, how they work, and whether they truly deliver on their promises. You're a nursing student facing a tough deadline. Maybe you've got a reflective essay, a complicated care plan, or a critical analysis of ethical dilemmas, and you're unsure where to begin. That's exactly where Nursing Assignment Help comes in. With UKEssays service, you just send them your assignment brief, and they match you with a fully vetted nursing expert who handles the writing. You then use that finished assignment as a model to deepen your own understanding, improve your skills, and feel confident you're hitting all academic requirements. UKEssays say their nursing writers include UK-registered nurses, holders of PhD, MPhil, MSc in nursing, PG DIP graduates, advanced nurse practitioners, and even nursing lecturers. Whatever the assignment, they aim to match your work with someone who has the right expertise. Every submission then goes through a rigorous review by an academic quality team to make sure it meets your stated requirements. That's part of their final grade guarantee. You get work meeting the standard you asked for, or you get your money back. They also guarantee fully original work. Each order comes with both a plagiarism and an AI authorship report, so you can be confident your work is unique. UKEssays claim a verified rating of 4.4 out of 5 across over 1,800 genuine customer reviews. And since 2003, they've served more than 25,000 nursing students. Their pricing for a typical undergraduate assignment, say 1,000 words with a 7-day deadline, starts at about £99. Now, let's dig into what kinds of nursing assignments they cover, because Nursing Assignment Help can mean many different things. They list reflective essays, care plans, evidence-based practice essays, case studies, health promotion work, professional and ethical essays, research proposals, medication management topics, portfolios, and group presentations. If you don't see your assignment type, they encourage you to just submit it under essay and explain the details in the order form. Reflective essays are popular in nursing. Students often reflect on clinical experiences, perhaps a challenging patient interaction, an ethical dilemma, or something emotional during placements. UKEssays writers help you structure those reflections using recognized models like Gibbs's cycle or Kolb's learning cycle. The idea is to show how you learn, grow, and reflect as a practitioner. When it comes to care plans, their writers tailor them to the patient scenario, acute problems like post-surgery infections or chronic conditions such as diabetes or dementia. The care plans don't just list interventions, they show rationale, reference guidelines, address patient needs such as mobility, nutrition, and discharge planning, and explain decisions clearly. Evidence-based practice essays require more than just describing studies. UKEssays writers analyze methods of research papers, critique limitations, summarize relevant findings, and link them to everyday nursing practice. Whether the topic is infection control, patient safety, or new tech in healthcare, the goal is showing you can apply recent evidence to practice, not just narrate facts. Case studies dive into clinical situations. For instance, a patient with diabetic ketoacidosis, complications of comorbidities, post-operative care, or multi-system health issues. Their writers identify key nursing problems, propose evidence-based interventions, predict outcomes, explain clinical reasoning, and include up-to-date references. Health promotion assignments often involve designing projects, say reducing teenage smoking, improving nutrition, boosting vaccine uptake, or maternal health interventions. The work must show you understand behavior change theories, public health approaches, and how to engage diverse communities practically. They make it look feasible, grounded in current nursing standards and public health initiatives. Professional and ethical issues essays tackle heavy topics: autonomy, consent, confidentiality, patient advocacy, accountability, negligence, and balancing care with limited resources. Writers use clinical examples, legal and ethical standards, and up-to-date nursing guidelines to form balanced, clear arguments. Research proposals are among the more technical assignments. UKEssays experts help you state your research question, justify methodology, examine ethical concerns, anticipate outcomes, and frame significance. They tailor proposals to your academic level and criteria. Medication management topics require precision. Their writers cover correct drug administration, error prevention, pharmacology, side effects, patient education, and ethical implications. Because mistakes in this area have clinical consequences, assignments are expected to be rigorous, accurate, and properly referenced. Portfolios showcase your nursing competencies, documenting clinical skills, self-reflection, narratives of experiences, assessments, and growth. Their writers help you present competencies like wound care, IV therapy, communication, record keeping, and patient education, then link them with reflections, growth plans, and standards expected of nurses. Group projects and presentations are also covered. Whether you're presenting on fall prevention in elderly patients, safety protocols in wards, or analyzing health policy, UKEssays writers ensure your presentation is clear, professional, analytical, and shows teamwork and critical thinking. What are the benefits of using nursing assignment help from UKEssays? First, you get access to writers with relevant nursing qualifications and academic experience. That match can give your work credibility. Second, you avoid plagiarism risk because they guarantee originality and provide plagiarism reports. Third, the final grade guarantee reduces your financial risk. If the work doesn't meet your standard, you get a refund. Fourth, you save time, especially if you're balancing clinical placements, exams, and other assignments. Fifth, the delivered work can serve as a learning model. You can see structure, argument flow, referencing, and clinical reasoning in action, which helps you hone your own writing. Sixth, all work is delivered on time. If it's late, they say you'll get your money back. Seventh, transparency. They use verified reviews and show real customer feedback to build trust. They present social proof. Over 25,000 nursing students served since 2003. Reviews from reviews.io, and lots of press coverage. UKEssays also invite customers to review their experiences. In sample reviews, clients say the writer followed instructions perfectly. The work was exactly what they needed, and they would definitely recommend the service. There are a few risks and considerations you should keep in mind when using nursing assignment help. Many universities have strict policies against submitting work you didn't write yourself. If your institution considers this academic misconduct, you must be cautious how you use the delivered document, ideally as a study guide rather than a piece you hand in verbatim. Also, the ethical dimension. Learning the material yourself is critical in nursing, since your competence affects future patient care. And although UKEssays aim for high quality, there's always a risk that the match to your assignment brief isn't perfect. Writing with local guidelines, institutional preferences, or course rubrics might differ. Be ready to revise or refine the delivered content to align with your specific criteria and style. In summary, Nursing Assignment Help via UKEssays offers a full suite of services, from reflective essays to care plans, portfolios to presentations, backed by qualified writers, rigorous review, originality guarantees, refund policies, social proof, and a grade guarantee. Used wisely, primarily as a model or learning tool, this kind of service can save you time, reduce stress, and help you see how top-level nursing assignments are constructed. Just stay mindful of your institution's rules and adapt the work suitably. Thanks for watching the Review Network. If you found this review helpful, don't forget to like, comment, and subscribe for more in-depth investigations into the tools and services that matter most to students.